Well, I'm biased, but I think psychological treatment has been really is really revolutionising care in places where it's available, because it really changes the attitude, the way people interact with people with psychosis, the way service users can develop these techniques quite often and work with others. And in fact, we've learned a lot from Hearing Voices Network in the UK, which showed us a lot of the ways in which people can communicate about voices very productively. So I think those are some of the most important developments. I think the whole issue about how do we implement evidence-based practice is an absolutely key one now. And we're looking at doing that much more systematically in the services in which I work, so that we get really good outcome measurement in place, so that we use something called the Health and Nation Outcome Scale, which quantifies a clinical assessment, and dialogue, which is a patient-rated outcome measure, which asks people about their satisfaction with different levels of care. And that's been shown alone to improve quality of life. And then you can add Dialogue Plus, a solution-focused approach to it. And these are some things that community care workers, psychiatrists, psychologists and others can all use, can use readily. It gives you a good idea about whether you're making progress, because if the area they identify as a dissatisfaction is somewhere they want help with, and you offer that help and they feel better for it, it's a pretty good outcome measure basically. And then following on from that is really just rating against the different quality standards that are really so important in terms of care of people with psychosis. Again, the National Institute of Mental Health the National Institute of Clinical Excellence in the UK has set a series of quality standards about physical health, about family work, about employment, and about CBT for psychosis. And we're now reaching a point where our patients are being assessed against those. And we know much better now whether those standards are being met, are in progress, or not being met. And if they're not being met, is it the resource isn't there and available? And this is giving us much better understanding of how we can design services effectively, design training so that training's put in place that's appropriate, and at different levels as well to sustain treatment. So I think that's moving forward. I think that's going to be a very, very important development in the next few years, because it's great having the treatments. You've got to have them available though, and you've got to have people actually using them and getting involved with them.